Deonandan. He is an epidemiologist at the University of Ottawa. Good afternoon.
Good afternoon. How are you?
Very well, thanks. So we've had weekly reporting for the last few weeks and now a new web page. What are your thoughts on the new way the province is sharing its COVID data?
I don't like it, to be honest. It comes down to why the change. We're used to daily reports, and now we have weekly reports. And frankly, you're signaling by doing this that the crisis is over and that we've settled into some new kind of normal. And I don't think that's appropriate. I think the crisis is still with us, and people have a right and a need to see daily information. But more importantly, it's what does it mean for citizen scientists? If you don't work with the government, you probably don't have access to the raw data unless you can download it somewhere. And so many people rely upon that daily data to do their own pandemic management information planning and so forth.
A lot of people probably won't be thinking about that this information is accessed by, scientists really across the country. So, is that information that is available online in this new way, is it enough for the kind of work that people like you do?
Well, first of all, I'm assuming you can't download the raw data. If you can, well, that changes things somewhat. But if you can't, well, you can't construct a proper epidemic curve without daily incidence data. You need that. Weekly data doesn't do it. You can't make evidence-based decision with less evidence. You need more evidence. Really, though, my biggest concern is the crisis of trust that we have around the Western Hemisphere. We have a crisis of trust in our decision makers, in scientists, in media, in the so-called elite. And you don't solve trust. You don't build trust with less transparency. You build it with more transparency. And I think people need to see how things are going, whether it's going well or going poorly, with as much granularity as they can in order to have renewed trust in the people who collect this information and make decisions based on this information.
There's still a fair bit of information available on this new webpage, especially if you hit the full report, although the highlights are quite brief. But the big change, the province had been sharing the numbers of people in hospital for COVID as well as those who were in hospital for something else and then test positive for COVID. That stopped with the change to the website yesterday. And the Chief Medical Officer of Health says that's in keeping with the way that neighboring provinces are reporting hospitalization numbers. But it is jarring to see the numbers suddenly drop by about half in a single day there. What do you think of a change like that?
I think it's important to have both kinds of information present, the incidental COVID hospitalization and death data, as well as that data, those deaths and hospitalizations which we think are causal. It's important as well to be transparent about the methods by which we assess whether or not something is causal, and the estimates of the percentage of incidental cases that are truly causal vary from 20% to 50%. And I think by saying it's the way that other provinces do it is a bit of a cop-out. Each province has autonomy to make evidence-based decisions based upon their own internal values and what they think is right. You don't have to follow along what other people do. But it is important to distinguish between cases or hospitalizations where you happen to have COVID versus those that are caused by COVID, with the caveat that even if you just happen to have COVID, that does have a cost to the healthcare system. You have to enact isolation protocols and so forth. And if you come in for diabetes or heart disease, the COVID will accelerate that. So these are not cut and dry distinctions. There's some overlap.
How are other provinces tracking and making data available, as those restrictions drop all across the country?
There seems to be a movement to do exactly what New Brunswick is doing. BC famously has moved to weekly reporting as well. Ontario still does daily, though there is some whisperings of a desire to retreat from that as well. What I like about the way that Ontario does things, and Quebec as well, is that you can download the raw data file and do your own analysis if you need to. But that requires some expertise. So unless you are a well-heeled quantitative analyst, you probably can't do that well. So I think it's important that the citizens see the daily numbers with as much transparency as possible. But yeah, there is some diversity, but the trend seems to be towards sharing less.
At this point in the pandemic, does it make sense to make less information available? Would that make sense in the coming weeks?
It never makes sense to share less unless there is a resource reason for it. If it's costing too much to make this information available, if the bandwidth is too great for people downloading things. I don't think that's the case, though. I think the desire here is to push the narrative of normalization, which is unfortunate. These things should happen organically. They should not be driven by a desire to make an ideological shift in how we think about the pandemic.
This happens, of course, at a time when people are asked to make more of their own decisions about, how they conduct their daily life, whether they want to wear a mask or they don't want to wear a mask, or whether they want to go to a social gathering or make a decision not to go. What do they really need to know at this point? What information really needs to be shared with the public?
That's a tough question. I think for individual decision making, you need to assess your own risk situation. And that risk is based upon your family's needs, your vaccination uptake, your immunocompromised status, your individual health, but also the nature of transmission in your community. Is there granularity in the data being shared about the burden of disease where you live? With a demographic breakdown, with a neighborhood breakdown, with a daily fluctuation analysis. That would be ideal. That way you can gauge the threat posed by going out into your neighborhood versus how much personal protection you happen to have.
Are you able to do the work that you do based on the information that you're getting all across the country at this point? Or are you able to get what you need?
Well, most of my work is in communication of pandemic situations and analyses. My colleagues, however, who do actual analysis will struggle with this. So the modelers, for example, rely upon transparent, complete sharing of raw data. The graduate students who do some of this analysis on the side rely upon stuff they can download directly from the website. So for some individuals, this will be compromised, yes. For those at the highest levels of operation, you probably still have access to the raw data with the appropriate negotiations. But for, I think, a large cadre, this will be compromising.
All right. Listen, thanks so much for your time this afternoon. Really appreciate it.
It's my pleasure. Thank you.